The teres minor muscle. The teres minor lies inferior to the infraspinatus muscle on the lower scapula. It shares identical functioning to the infraspinatus, but is controlled by a different nerve supply. Here are the landmarks for the teres minor. We have the scapula, the humerus, and the glenohumeral joint. The teres minor originates near the inferior angle of the scapula and inserts on the greater tubercle of the humerus. Contraction of the teres minor produces lateral rotation of the upper arm at the shoulder. The infraspinatus assists the teres minor during lateral rotation of the arm, and the subscapularis and pectoralis major oppose the teres minor during lateral rotation of the upper arm. Clinical findings for the teres minor trigger point. Dr. Travell refers to this muscle as the little brother to the infraspinatus muscle. Associated symptoms include a well-localized spot of pain and tenderness in the posterior shoulder region. This pain is often confused with painful bursa or bursitis. Activating or perpetuating factors for a trigger point in the teres minor muscle include reaching out and behind the shoulder, holding on to the steering wheel during automobile accidents, and playing volleyball. Trigger points in the infraspinatus muscle and the other rotator cuff muscles are functionally associated with the trigger point in the teres minor muscle. Some common misdiagnoses for an active trigger point in the teres minor muscle include rotator cuff lesions, ulnar neuropathy, C6 radiculopathy, and bursitis. To locate and release the teres minor trigger point, start by modifying the client's side lying position by placing their top arm on the table in front of them. Now locate the inferior angle of the scapula as your landmark for this trigger point. The teres minor trigger point lies 3 to 4 inches above the inferior angle landmark near the lateral border of the scapula. This trigger point refers a well-localized spot of pain and tenderness on the posterior shoulder region. Use a supported thumb contact to apply pressure to the trigger point for 6 to 8 seconds and repeat 4 times. With your client side lying, locate the inferior angle of the scapula by having them drop the arm behind their back. Now bring the arm in front and rest it on the table. From the inferior angle of the scapula, move 2 to 3 inches up and 2 inches lateral to locate the teres minor trigger point. Using a thumb over thumb technique, apply pressure straight down to the table and hold 4 to 6 seconds. And release. Again, repeat. You can also, as you see here, do a stripping technique towards your client's shoulder. Hold the pressure at the end of the stripping technique and repeat 4 times.